Okay. This is my dad. Godwin Obiajunwa was an educationist in Nigeria. In 2007, he was diagnosed with diabetes. 7 years later, at the age of 64, we lost him from complications of diabetes. Ironically, I was in another part of Nigeria treating diabetic patients. If there was a way I could monitor my dad's condition from where I was, mortality wouldn't have resulted how and when it did. Just like me, there are millions of family members of diabetics who are frustrated and have no clue on how their loved ones are coping with diabetes management. What they need is a platform that is easy and cost-effective to help them monitor and track how their loved ones are coping with their condition. App fatigue have been identified as a major reason why diabetics don't stick to their mobile apps in the management of diabetes. What they need is a platform that is able to connect them and help them keep coming back engaged to their platform, to the mobile app platform. Loneliness is a cause of depression in diabetics. And depression has been identified as a major cause of non-compliance in diabetics. What they need is a platform that is able to give them social and emotional support. These are real problems of real people. The good news is that we can do something about it. My name is Obichi Obiajunwa. I'm the CEO of Diabuddy. I'm a physician with 6 years experience in clinical practice and public health practice. I'm currently an MBA student at the George Washington University.
I'm Piyush. I'm Chief Strategy Officer of Diabuddy. I have 7 years of global work experience in software development and banking operations management. I'm also currently doing my MBA from George Washington University.
And my name's Nina Mezu. I'm the Chief Technical Officer, and I've been working in the bioinformatics field for 7 years.
At Diabuddy, we believe we have a product that is able to connect diabetes to the most important people in their lives. That would be their loved ones and their physicians. This way, they get social support, emotional support, and functional support, which will enable them to increase their compliance to their prescribed therapy. At the same time, Diabuddy is able to prevent developing diabetes or prolong its manifestation in loved ones of diabetics who are primarily at risk of developing diabetes. And this is using our behavior change models and algorithms. Last year at Tel Aviv University School of Business Incubation Program, Diabuddy emerged the most innovative idea in the program. And there is no better time to discuss diabetes management other than now, when the World Health Organization has declared diabetes a global public health emergency.
In the United States, more than 1.4 million people are being diagnosed with diabetes every year. 1 out of 11 Americans is diabetic. 1 out of 3 is pre-diabetic. Unfortunately, less than 40% of the patients continue adhering to the regimen after 24 months of being diagnosed with this disease. Such ignorance leads to severe complications and costs $245 billion to America every year. This is where Diabuddy comes in.
Diabuddy offers 5 key features to connect, predict, track, contact, and engage. Diabuddy offers a social platform for diabetics to connect with their loved ones and physicians. Diabuddy also offers a tool that will help predict risk levels in developing diabetes for loved ones. With the help of our advanced algorithm and usage of machine learning APIs, we aim to provide personalized recommendations for our users. Diabuddy also offers tools that will help track daily blood glucose levels, medication alerts, activity levels using a built-in GPS tracker, and meals with the access of an extensive food database that will estimate calorie intake. Diabuddy also offers instant messaging that will allow diabetics not only to contact their loved ones and physicians, but also to be in contact with certified diabetic educators. And lastly, Diabuddy aims to engage. Diabuddy has exceptional and innovative tools that will help engage our users. These tools include gamification, champion challenges, and the access to a marketplace.
Our value proposition is simple. We hope to provide social support that would enable persistent change in habits for diabetics and their caregivers. Research has shown that clinical intervention strategies that involve family members in the management of diabetes are both cost-effective and yield better clinical outcomes. Our customer segments would include diabetics, pre-diabetics, their loved ones, all within the ages of 18 and 80 years, and then their physicians. To validate our value proposition, we went out to speak to our potential customers. We made two important discoveries. Speaking to diabetics, they said that they would want the platform to involve their loved ones, not just their family members. And then to the family members, we realized that some of them are pre-diabetics. That got us to include pre-diabetics as a customer segment in our platform. Other discoveries we made were that the diabetics said they would recommend our product to their children, so that they would be able to be informed actively on how to manage diabetes and prevent it. The pre-diabetics were excited about the fact that we're able to predict their risk and then give them personalized recommendations on how to prevent diabetes.
After our interviews and our research, we were able to identify 4 key gaps within the diabetic app market right now. Those gaps include app fatigue, poor usability, limited functionality, and lack of support. Among our top competitors, Diabuddy is the only app that offers a gamification tool and focuses on prevention of diabetes. Among our competitors, we also offer integrated platforms, social connection, and goal challenges.
Diabuddy is a tech-enabled platform, which means it can be integrated with other diabetes management applications, devices, and databases. Its social networking ecosystem, connecting with friends, loved ones, or family members, is the source of motivation for these patients. And these features make Diabuddy far superior than any other application in this market segment.
Diabuddy is a freemium model. That's how we make money. But we anticipate that 10% of our clients, of our customers, are going to be premium subscribers. And the premium features would include PDF reports, the gamification, connection to physicians, connection to diabetic educators on our platform, goal challenges, and connection to glucometers. We have 3 pricing segments. First will be the individuals who would subscribe for $30 per quarter, the duo who would subscribe for $25 each per quarter, then the group that will subscribe $20 each per quarter.
We believe that our best customers would stick to our app for at least 2 years, and we hope to make a lifetime revenue of $160 per best customer at an acquisition cost of $18. And we hope to make a lifetime net profit of $89 per best customer and $44 per average customer, whom we assume to use our application for at least 1 year. By the end of 3rd year, we hope to have 5 million downloads of Diabuddy worldwide, capturing 2% of total addressable diabetes management market, which includes 260 million type 2 diabetic patients and their loved ones, making a gross profit margin of 67%, which is within the industry range. With all these estimates, we hope to break even by 3rd year at 120,000 premium subscription downloads of Diabuddy.
We have 2 strategies to get from initial traction to initial scale. First will be strategic partnerships with insurance companies, physician groups, and pharmaceutical companies as well. These partnerships will also be our channels to our customers. Second is retention strategies. We hope to lengthen the stay of our average customers for more than 1 year. And our innovative tools to do that would include the gamification, the goal challenges, incentives for active use, and incentives for referral.
Using seed funding of at least $20,000 from new venture competition, we hope to first set up our company, and second, we would like to develop our product prototype. New venture competition grant would definitely improve our credibility and our chances of gaining other rounds of funding. In the first round, we would like to gain $350,000, which we would invest on developing our application on iOS platform. And in the second round, we would like to gain $800,000, which we would invest on developing our app on web and iOS platform, research and development of various other features, and necessary marketing and sales activities.
By the end of this year, we hope to have launched Diabuddy. By the first quarter of next year, we want to raise the second round of our funding. By the third quarter of next year, we hope to launch on Android and web platforms. And by the last quarter of next year, we hope to expand to European markets. By the last quarter of 2019, we hope to be expand to Asian markets, and that will be with an estimated downloads of 5 million. Apart from being the CEO of Diabuddy, I'm the founder of Chutzpah Hub, which is the first health tech hub in Nigeria. I'm also a mentor at the New York Academy of Sciences, a STEM mentor, and a guest mentor at the NIH Commercialization Accelerator program.
I also worked as a product manager for a DC-based startup from Reciprocare Solutions. And back in India, I co-founded one of the largest nonprofit organizations, Humanity First Foundation in India.
Currently, I work as a bioinformatics developer for the National Institute of Allergy and Infectious Diseases, and I have a master's in biotechnology specializing in bioinformatics. We also have an experienced board of advisors, including Mr. John Rowlands, who is a board chairman of MedStar Hospital. We have Professor Joshua Cohen, who is the director of endocrinology unit at GW Hospital, and his areas of research is in the mobile tech use of managing and preventing diabetes. And we have the CEO of Griot, Mr. Charles Kaiser.
Thank you.
Thank you.
So, if I understand correctly, a lot of a key component of this will be keeping tabs on the status of a diabetes or pre-diabetic patient, right? Including testing, I would assume, glucose testing.
Yeah.
What type? How does that work, and what other types of monitoring must a user do to get the results in this app that's then shared with their family?
Right. So what happens today is that glucometers are used to check the glucose level, the sugar level in diabetes. So when they do that, they log in manually to the platform. And when they log in manually to the platform, you can actually send it and share it to whoever is connected to you. But recently, there has been this integrated platform where some glucometers, now you could automatically send the reading to the platform, connecting it to the APIs, right? So that's really how it works now. So Diabuddy is going to be able to integrate to those APIs such that we automatically read the glucose reading from the glucometers on our platform. And when it's there and you're connected, active and engaged with anybody in your network, they'll be able to know what your readings are. But you should have given them the permission to see those.
Okay, so with existing glucometers, you're saying you'll integrate with those to be able to read those results?
Yeah, existing
regardless, ideally, of what platform they're using?
Right, existing glucometers.
So in your strategy there with the growth curve, it shows you launching in the U.S., but I was surprised in your presentation you never really mentioned anything about like the biggest player in the healthcare market in the U.S., the federal government. So what kind of regulations will this app need? What kind of FDA certifications are you seeking? And yeah, maybe we'll start.
Right. So we are in the Type 2 device classification of FDA. All it takes for us would be to inform FDA, that we want to launch such an app, which we have started doing that already. We have started talking to device segments in the FDA. That's all we take. We don't need to go through, because we are 510K, we don't need to go through the long process of clinical trials and all of that, right? So because we are the class 2, type 2 devices. Yeah, and then, okay.
You have a 510K?
Sir?
You have a 510K file?
No, we just, no, that's what we are going to be filing. That's the class. But we,
okay, do you know what your predicate device is going to be?
sorry?
Do you know what your predicate device is going to be when you file it?
Predicates.
For a 510K, you have to, in order to qualify for a 510K, you have to have a device that's similar to your product.
Yeah, so we have similar devices that connect persons that use a mobile app to their family members. But how they do that connection is simply alerting their family members of danger situations. So if the child has a low glucose reading, hypoglycemic, their loved ones or their carers would get an alert that there is danger. That's how that happens. And those have gotten clearance from FDA already.
Wait,
and
so
then the market.
The physician will get an alert?
No, their caregivers will get an alert. But if the physician is connected to the platform, they could also get an alert.
If I understood you correctly, like looking at the slides that went by quickly, in year 3, it's 5 million subscribers, correct?
Yes, sir.
You don't need to go back to it.
Okay.
And I saw your spend was roughly about $1.1 million. 800, 300, and then 800 were the rounds. And the source and use of funds was across the board. It was R&D, it was product development, it was marketing. So can you explain to me, let's say you're going to spend in your spreadsheet somewhere $500,000 on marketing is going to acquire 5 million subscribers, or some amount of that dollar spent, correct? Some amount in your spreadsheet of that 1.1 is going to acquire 5 million subscribers. Can you explain to me what that spend is that's going to get all these subscribers?
Okay, if I talk about it, the spending we are looking at would be in the sales and marketing. That's where the major spending we anticipate to be. And then
My question is please do not use, I understand it's a marketing line item. What specifically within marketing or whatever program you have is going to produce the 5 million subscribers?
Facebook marketing.
okay, go ahead.
Yeah, we did some research and we found that we can reach as many as customer possible in the target segment through Facebook advertisement platform, and it would cost us around $1.5 per click per customer. And using that data and our expectation to capture 2% market share by the third year, we estimated these figures that it would cost $18 per customer to acquire them, and we would be able to achieve 5 million downloads if we expand into Asian and European markets.
Right. Okay. More on that, on how we could acquire such number of customers. Remember, ours is a lot easier than traditional apps out there on diabetes because we have the network effect, right? So if one person downloads our app, there is a tendency for them to invite their loved one who is going to be on the other side because it's a two-sided platform, a multiple-sided platform. That makes our marketing a lot easier than an individual user, than a one-sided market. If you're an individual user, would have to download and stick to it without inviting anybody on the platform. So that divides or reduces our cost of acquisition per customer. I don't know if I can.
Where did you come up with the pricing? I was wondering if the sales wouldn't be better directed towards the family members and the caregivers if the diabetic person may not be the one who really will buy it.
Exactly. So that is one of the the first question you asked about how we got to the pricing was value-based pricing. When we talked to our customers, we asked some of them how much they would want to pay for such a connection that will link them actively to their loved ones. And some of them, people working here and studying here while their loved ones are somewhere part of the United States or outside of the United States, they imagined how much they spend currently as well, trying to communicate and all that. So we came to a rough estimate of how much they would likely come to pay for this. And again, like you said, that we are targeting family members and caregivers of diabetics makes our marketing a lot easier. That's why we can leverage the platform, social media platform that already exists. And